Today I'm going to go over ABGs. So if you have an order for a patient to have ABGs drawn, you're going to check the patient's chart, look to see if there's any anticoagulation issues, if they're on a blood thinner that would indicate you would need to hold pressure longer after the needle stick. Go to the patient's room, knock on the door. Hello, Mr. Blank, my name's Trisha. I'm with Respiratory Care, and today the doctor would like to draw some arterial blood gases. This is blood from your arteries. It's a little bit different than from your veins, like you've been getting your blood draws every morning. This is going to show us how your breathing is affecting your system. So we're going to go ahead and get that taken care of today. It's a little bit more of a poke than it is with the other needle sticks you've gotten, but we will go ahead and get started. I'm going to sanitize my hands, put my glasses on, and Mr. Blank, can I get your name and date of birth before we get started? Okay, so what I'm going to do first is I'm going to check your arm, this arm here, and I'm just going to palpate to make sure I can feel. I do feel that artery right there above your thumb there. And then what I'm going to have you do is I'm going to include both your radial and your ulnar arteries, and then I'm going to have you make a fist with your hand. Do that a couple, 2-3 times, and then I see that your hand is blanched. So then I want you to just relax that arm, and then I'm going to go ahead and let go of your ulnar artery. And then I see that your hand is pinking back up very quickly. We want that to return to the normal color, and I see that's doing that. So that just means you have enough collateral circulation within this arm that we can use this arm. So then we're going to have you place your arm up on this towel. I'm going to have you just relax that arm. This will kind of help stabilize the artery a little bit, or the vein a little bit for us, artery that we're going to use. So I'm going to first prepare the area, rub it vigorously for 30 seconds in a circular motion. And then I'm going to make sure we have our supplies. We have our needle, we have our Band-Aid for afterwards, our gauze pad to hold pressure, we have our cork to put the needle into, and then a device that will get the air bubbles out of the syringe afterwards. So first, we're going to pull back. We want to do at least a half a cc, if not a little bit more, on our syringe here. Palpate that artery again. I would hold the palm of my hand in my hand into their hand to kind of stabilize. Hold that artery there, or check for that. And then I'm going to insert the needle. I'm going to do a 45-degree angle with the bevel up. So we're going to insert it right into that artery, kind of hear or feel like a popping noise, and it's going to pre-fill that syringe. The blood will be a little bit lighter, and it will go ahead and fill that syringe for us. Once we are done with that, we are going to go ahead and put pressure on that as we release. Place that into the cork, and then we're going to hold that pressure from 3 to 5 minutes if they do not have any bleeding disorders, if they're not on a blood thinner, 10 minutes or longer if they are on a blood thinner or have any bleeding disorders. So we will hold that pressure, then we will look at the site, apply the Band-Aid, then we would remove the needle from that cork, and then we would put the syringe into this little device here to remove any air bubbles and get this to lab as quickly as possible to have that analyzed.